Hello and welcome everyone. It's November 3rd, 2020, the day you've all been waiting for, the O'Brien Institute for Public Health Town Hall. So my name is Lynn McIntyre. I'm Professor Emerita in Community Health Sciences and also a member of the O'Brien Institute for Public Health. I'm delighted to be your moderator today for this town hall. So first, I would like to take the opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, Wellesley First Nations. The city of Calgary is also home to the Métis Nation of Alberta, Region 3. So before we begin, a few housekeeping matters. So we are having a town hall, so that means we don't have Q&A. We have a chat box. So you're asked your questions, please, at the time after the presentations by putting them in the chat, or you can use that hand icon that is under the reactions category. And Pablo is going to be helping me moderate these barrage of questions since there's a lot of people online. So we'd like everyone to keep their video on so we can all see each other, but also mute your mics unless you're speaking. And then we do hope to get through questions, and if we have any left over, we will get back with you if you could send us an email. And we are going to record the meeting so that we can you can view it later. So the program for today, next slide, is Christine Friedenreich will be giving you an update of the last 8 months of the O'Brien while she was serving as the interim scientific director. And then we're going to be unveiling Dr. Tom Stelfox, who started this week as scientific director for the O'Brien. When they finish their presentations, there'll be the question and answer time period, lots of time we hope in this session, and we will close promptly at 1 o'clock. So without further ado, then I think I turn it over to Christine.
Thanks very much for that introduction, Lynn. And I want to just start with a little overview of what it is that I'm going to be presenting this afternoon. And so this slide shows that I want to, first of all, start by thanking Lynn McIntyre, who was so willing to join us as the Associate Scientific Director while I was doing this role for the last 8 months. It's been a real pleasure working with her. She brought all of her corporate memory and knowledge about the Institute over the last 10 years to bear and really assisted us quite a lot. I'll be giving you a little bit of an update on what we've done as far as our Strategic Advisory Board is concerned, the Executive Committee, the research groups, units, and centers, how we've been working with fund development, and also talking about the RFP that we've landed for the strategic plan. Next slide. So I just thought it would be useful to look at a little bit of the organizational structure of the Institute to begin with. The director of the Institute, Tom Stelfox, reports up to the Senior Associate Dean Research, and I'll be working with Tom as well as Dr. Jamie Day, who's the Administrative Director. Then we have a core operations team, and we'll be showing you some slides of that team so that you know who's on the team with us. We have a Strategic Advisory Board and an International Scientific Advisory Group that help direct the Institute and help advise us. And then we also have our members involved in the Executive Committee and research groups, units, and centers. Next slide. So this is the actual org chart right now. This has evolved during the last 8 months, and I want to particularly highlight the new initiative in social and structural vulnerabilities program, which is being led by Dr. Katrina Mullaney. We have just recently also hired Natasha Hoon as the research associate in that program. And we also have a new staff member working in the Brenda Stratford Center on Aging with Ann Tui, Chantel Zimmer, who's just joined us in the last few weeks. We'll go to the next slide. And here is our core team. So Tom, who's now the new scientific director, I will be your associate scientific director, and Jamie Day, the administrative director. And I do want to give a real shout out to Jamie Day, who's been with the Institute for the last 10 years and is really the heart and soul of the Institute and keeps everything running so smoothly. And so I really want to thank her as well for all the assistance that she's provided in the last 8 months. We have Pablo, who is the manager for the communications team. And on his team, a wonderful group with Brittany DeAngelis, who's the senior communications coordinator, Angela Taylor, who runs her communications, and Jade, who also helps with communications. We have Marie-Claude Pou, who's the project coordinator, who does all of the HR and financial things for the Institute, and Leslie Campbell, who's just recently joined us as the administrative coordinator, who worked with Tom actually previously and has now come with us to the Institute. Next slide. Also on the team, as I mentioned, we have some new people working with us. Already mentioned Natasha and Chantal. And then we have the Street Cred program with Steve, that's being led by Steve Richardson. We also have the Make Calgary program, and Fiona Boulay is the program coordinator for that. And then Dr. Ann Tui is the manager for research and scientific programs for the Brenda Stafford on Aging. Slide. So now I want to talk about our strategic advisory board. So this actually has undergone quite a large changes since our last meeting in March. We have now got Gail O'Brien, who's one of the naming donors, as the chair of the strategic advisory board, and we have 9 new members. That includes William de Jong, who's a new community member, and Bonnie DuPont, and Julie George, and Candice Gowdy. We have continuing members here with David O'Brien, Lachlan Curry, Gary Jakes, and Webster McDonald. Next slide. We also are very happy that we have Alice Rammer, who's joined us, and Bart Johnson, who represents Alberta Health, Laura McDougall, who's representing Alberta Health Services, and we've also added Katie Black from the City of Calgary, who's one of their senior leaders. So a very nice mix of new and old on the Strategic Advisory Board. And then one more slide to show the members of the University of Calgary's Cummings School of Medicine and BPR office. These are the members that we have. And another thing that we've changed is we now have one of the O'Brien Executive Committee members, Dr. Aline Barwani, who also sits on the Strategic Advisory Board to represent the members. We have updated the terms of reference for this board, and we've created 3 subcommittees from the board that are in the areas of health services research, public health research, and community philanthropy. And those 3 subcommittees are being constituted now. We've developed some terms of reference for them, and we will be meeting for the first time in November with those subcommittees. And they will be a combination of members of the Strategic Advisory Board, but also this will be open to anyone from the O'Brien Institute members who would like to serve on those subcommittees. And really, these are a way of informing us as an institute on some of the top areas of research interest and policy interest in health services and public health that we will be focusing on. Next slide. We've also made quite a few changes to the executive committee. We've streamlined it quite a bit. We created a new portfolio that Dr. Aliyah Kassam is now leading on equity, diversity, inclusion. And she was previously leading the mentorship and leadership portfolio. We now have Leora Rabatash, who's going to be leading that with another member to be determined. Dr. Deborah Marshall continues in the internal peer review portfolio. We're also going to be expanding and expanding the mandate of that particular portfolio and adding some other members from the O'Brien Institute members to assist with that. And we're looking to have a whole suite of options for internal peer review that would include mock grant panels. Another change that we made was to merge the policy and partnerships portfolio into one combined portfolio that's overseen by Dr. Aline Barwani, and he has 2 co-leads. Dr. Lorianne Hartcastle will be helping on the health policy side, and Dr. Nishan Sharma will be working on the partnership side. We're currently working on a health policy initiative with fund development. And so that's an area that's where we put quite a lot of effort. And we're very happy that Diane Lorenzetti continues to help us with the research impact assessment work that we do, and that Dr. Elizabeth Odom-Colucci is also helping with the trainees portfolio. Next slide. So another thing that we did during the last 8 months was that we had meetings with nearly every one of the research centers, units, collaborative initiatives, and research groups that we have. As you can see, the O'Brien Institute actually is very broad. We have a lot of different groups and units that are affiliated with the Institute. And so we have been meeting with the leaders of these different groups and units, talking about how the Institute can better serve and work with them, and making sure that we have still got good engagement in all of these areas, and also looking to see if there are other areas that we haven't got any groups yet that we might need to establish some. Next slide. And then the final group that is involved with our Institute is the International Scientific Advisory Group. So here are the 4 members of that group that came and reviewed the Institute most recently in 2019. And they were scheduled to come again in 2022. But because of the strategic planning process that we're starting on right now in 2021, I should say they were supposed to come in 2021, they will be coming again in 2022. And we've had very favorable reviews done every 2 years in the last several years. And I must say that this has been very good for our Institute to have this sort of external validation of the directions of where we are going. Next slide. The other thing I wanted to talk about was we also did 3 half-day retreats on our communications and event strategy, where all the core team members met to talk about what we do in events, which includes planning and promotion and logistics management for events. We also have a lot of activity happening in professional writing, which includes things like the You Today stories, press releases, brochures, and primers. We have a very strong social media presence. And so we talked about how we can maintain the Institute's social media platforms, which include things like Twitter, Facebook, YouTube, and LinkedIn, and any sort of campaign planning and advertising for the Institute members and groups that we do there. And finally, we have the area of digital publishing, where we manage a fairly beautifully newly updated website and do some advising on that topic for our members. So that's an area that is going to continue to evolve over the next few months as we develop our strategic plan. Next slide. We've also been working quite closely with our Fund Development Office in the Cummings School of Medicine and looking at new funding opportunities for the Institute with external agencies and donors. And we have established the Philanthropy Subcommittee of the Strategic Advisory Board that is led by Shirley Turnbull. And she has been meeting on a regular basis with fund development and some other donors. And we're thinking about what kind of fund development activities we can do, particularly in the COVID environment. But in the interim, we have been submitting applications to external funding agencies for some of the new initiatives, particularly in the social and structural vulnerabilities area, and also in the health policy area. Next slide. And finally, we launched into a very rigorous RFP process to look for an external company of consultants to do the strategic planning with the Institute for the next 5 years. We had 10 different groups respond to the RFP that we did through the Cummings School of Medicine, and we have chosen the company name Framework. And so you're going to be hearing a lot more about that from Tom, and also in the upcoming months, as we were going to be starting that work with them. And I think that might be it from me. Yes, so over to Tom now. So anyway, I just want to end by saying it's been a real pleasure working in this capacity for the last 8 months. And I'm really looking forward to working with Tom in the upcoming months.
Good afternoon, everyone. For those who don't know me, my name's Tom Stelfox. It's a real privilege to be here today. Thank you, Christine and Lynn, for your stewardship of the Institute these past 8 months. You've done a lot of great work, and we're very fortunate to have you. Today, we start a conversation about the future of the Institute. I appreciate you making time. I know you're all busy. The last thing you want is another Zoom meeting, but this is important. There are three things I'd like to do over the next 10 minutes before we open up the town hall for discussion. First, I want to reflect with you on where we're at as an institute. For those of you who don't know me, I want to briefly introduce myself. And I want to finish off by inviting you to envision the future of our institute. Christine has provided a very nice summary of our institute, its units, research groups, centers, collaborative initiatives, committees, communications, and fund development. It's a lot. Given everything we have done and everything we are currently doing, I'd like us to reflect on how public health is better today than it was 10 years ago before the Institute was founded. Can you please share some examples that resonate with you in the chat box? For example, for me, an example is the report on Indigenous Health Dialogue of Truth and Reconciliation within the Cummings School of Medicine. The report was written by many members of the Institute. It's early days, and I think we're going to see this report inform truth and reconciliation within our school, which will then permeate into research and education, and through that out into society. So I'm going to give you a minute to reflect and submit examples that resonate with you in the chat box.
So Tom, did you want to just repeat your question?
Sure, perfect. Yes, I'm wondering if people could just sort of reflect and then share with everyone on the town hall, what are some of the things that the Institute has done over the past 10 years that you feel have impacted public health, where we've made a difference? Thank you. I can see all kinds of comments coming into the chat box. They represent our actions, our impact, and really our diversity, which is really impressive. As further thoughts come to mind, please share them throughout our session. Next slide, please. For me, the Institute is like a book. It has many authors and many chapters that open and close. This is a picture of a 2007 art exhibit by a Mexican artist named Jose Mendez Blake. The exhibit was titled The Castle. And what he did is he constructed a 75-foot by 13-foot brick wall that balances on top of a single book. You can see the book at the bottom, where the wall bulges at its site. It creates an arch that extends all the way to the top of this precarious structure, cracks appearing between the bricks. It illustrates how words and knowledge can have a big impact. For me, this is what the Institute embodies: knowledge that shifts paradigms to advance public health. This is the work that Bill, Lynn, Melanie, Christine, and all of you have championed. What a privilege it is to be here with you, given all the Institute has worked towards and accomplished. Now, many of you will know me, but for those of you who don't, please allow me to briefly introduce myself. Next slide, please. This photo is all you probably need to know about me. Some of you will have already seen it as I used it in my job talk. And for those of you who have not, this is my extended family who have helped me to become who I am. In the middle of this picture are my parents. My father, Harry, comes from a pioneering family from the Rocky Mountain House area. My mom immigrated to Canada as a refugee from Eastern Europe after the Second World War. My wife, Sophia, is in the back row there with a purple jacket. She's an academic nephrologist who studies sex and gender differences in kidney disease. We've got 3 daughters that are sort of clustered down in the corner where I'm kneeling. Our 2 oldest were born in Boston. My youngest daughter, who's sitting in my mom's lap, is born in Calgary. This picture is actually 5 years old, so they're older than this now. In the back row, you can see my sister in the black jacket. She's a professor of engineering at the University of Alberta and is an acting associate VPR. Beside her is my brother-in-law, Jethro, who's a high school teacher, and well known in the Edmonton Catholic School Board for his work with First Nations, Métis, and Indigenous students. Opposite me in the front row is my brother, Simon, who's an entrepreneur, and behind him is my sister-in-law, who works in business. I have 2 nephews and 2 nieces. Let me briefly share with you the core values I've acquired from this community. So I believe in equity of opportunity, where we give everyone an equal chance. I believe in merit. We recognize people's efforts and accomplishments. I believe in community, our values and our people. I believe in impact. We're all on this planet for a reason. And I believe in compassion, that we extend a helping hand to those in need. My commitment to you is to live my values so you know exactly who you're getting, to champion excellence in research, knowledge translation, and public health, to listen, learn, and do my best. My door is always open, even if it's a Zoom door. Please reach out to me. Next slide, please. As I join the leadership of the Institute and working with you to continue writing our Institute's narrative, I think it's important we recognize that there's a shifting societal landscape. We live in a very different world than we did 1 to 2 years ago, yet alone 10 years ago when the Institute was first founded. These are some of the changes that I've observed. You'll know of other changes from your experiences. We have a changing economy. The 2-decade-long resource boom that we benefited from as a province is done, and it's unclear if and when it will return. The impact of this is translating to the health of the population, the university, which is expecting another year of budget cuts, and our community partners. Events from the past year have resulted in a call to action on racism against Black, Indigenous, and people of color and other oppressions. And health systems around the world are in transition, and like those in our province, may experience large changes in the coming years. Next slide, please. We also have emerging opportunities. The COVID-19 pandemic has showcased the impact we have when we bring the public health system, the healthcare system, and academia together to tackle our biggest public health challenges. There's a new University of Calgary strategic plan, Growth Through Focus, that's being launched by our president, Ed McCauley, to lead us through changes to post-secondary education. And Connect Care, an AHS initiative to provide the first provincial population-based hospital electronic health record, which will provide a tremendous opportunity for all researchers. You will undoubtedly be aware of additional opportunities. Next slide, please. Our people are our greatest strength. This collage of photos provides a small sampling of our members. Diverse, smart, hardworking, service-oriented, characteristics that allow us to take on the emerging challenges and take advantage of the emerging opportunities. Next slide, please. For us to write the next chapter of the Institute, we need to come together and develop a shared vision of the future. This image, or the image on this slide, is of a lens that helps to bring the future into focus. And from my perspective, we actually need 2 types of lenses. First, we need a wide-angle lens to appreciate the broad landscape of public health and the diversity of our members. And we also need a zoom lens so that we can focus our efforts to have maximal impact. Both are essential for us to engage and empower our members to set our direction, to champion transdisciplinary scholarship and community engagement, and to focus our impact through research and innovation. Next slide, please. And so to finish off, I think the question for us to ask ourselves now is, how will public health be better in 10 years' time because of the work we do? Today, we start to answer this question. Please share your thoughts in the chat box, how we can do this, and during our conversation for the rest of the afternoon. This is an important question for us to answer over the next 4 to 6 months. If we come together and figure this out, our next decade of impact will be about tackling the biggest health problems to raise the standards of care and improve health in Calgary, across Canada, and around the world. Thank you very much for your time.
Thanks so much, Tom and Christine. And now we're going to be able to turn it over to you. And again, you can raise your hand and we'll unmute the mic, or you can put your question in the chat box. Before we have any questions, I guess I just ask both Christine and Tom to look at that incredible array of topics that came out of the chat box on our impacts, and what is the way that you would say we need to move forward? Christine?
So one of the things that we were doing when we were soliciting input for the strategic planning process that our institute's going to be taking on was we actually talked to a number of different companies on the outside. And one thing that we really want to do is engage with our members. And so we've been thinking a lot about how we're actually going to do that. And so one of them is this town hall, but another thing that we're going to be doing is a survey of the members, and we really want to hear from you and find out what your priority areas are and what you would like to see us focusing on in the future. And so we're going to be doing a survey of our members. Then another thing that we will do is, and we've already asked for some input from people around a working group that will be working with us to help guide that strategic planning process with our external consultants. And we're very thankful for some of the people who've already come forward and have asked to be part of that working group. But we're going to be having a number of these kinds of groups who will be able to engage with us directly and give us your input on specific topics within what the Institute wants to do. So we have actually been thinking about this quite a lot because we really do want to engage with the members. So I think that's what I would say we'll be doing.
Yeah, so I mean, now that Christine's given a great answer, I'm not sure what to add, but I would sort of concur with her comments, which is that, you know, the value of the Institute is in the people, right? It's you. And so really important, and what we see here in the comments is that you bring a tremendous diversity of perspectives, experiences, and expertise to our Institute. And I think for us as an Institute, you know, we've been evolving for 10 years and we need to continue to evolve. And there have been some changes more recently that suggest we probably need to, this is a really good time to pause and reflect with what's happening in society, and to basically engage you in building a shared vision. And I'm confident that if we can do that well, that we're going to set ourselves up to then have a big impact in the next 10 years.
So we have a question, and I was aware that as they could move around. Okay, with the increasing focus on addressing racism and colonialism as public health crises and the mentions in the presentation of the critical need to address racism, what is the plan to increase the representation of Black, Indigenous, and people of color within the OIPH, including the broader OIPH community, but also the Strategic Advisory Board, to ensure these groups are included at all levels of the OIPH?
Well, that's not an easy question to answer, but clearly one that's really important. And I'll be honest, I think that we sort of need to look to the membership for a little bit of guidance on how we do that in a way that's respectful, thoughtful, and helps us to become more diverse. We obviously have a lot of diversity as an institute, and there's still clearly opportunity for the institute to be more diverse, and the leadership, the advisory boards to be more diverse. That's for sure. And so I think as we go through our strategic planning initiative and exercise, I think that's going to be one of the key questions for us: is how do we engage and build that diversity and engage with diverse members of our communities in a way that's respectful to them, that doesn't burden them, and that we're not sort of taxing underrepresented groups to be present, but they can meaningfully contribute so that we're dealing with the most important problems in society. So I recognize that that's a very maybe probably generic type of response, but it's I think what we have to figure out collectively together because it's important.
I think I could maybe just jump in and just say, we actually recognized this pretty early on that this was something that we needed to focus on. And so that's why we've created the EDI portfolio, and really thrilled that Aliyah Kassam is showing her leadership in that. Another thing that happened in the last few months was we had the opportunity as an institute to put forward some proposals for new Canada research chairs from CIHR. And so we put in a proposal for a CIHR Tier 2 chair in equity, diversity, and inclusivity. That was not put forward to the VPR office, but we have another opportunity this December. We've created a group of leaders within the Cummings School of Medicine, representing different departments and institutes, and we're working collectively to come up with a really outstanding proposal that will, be supported by the university, but then also go up to the federal government for funding. So I think bringing in, some senior leaders who can help us formulate what we want to do in the EDI area will be very important. We've also got a group on, I noticed that Pam Roach has asked about what we're going to do on Indigenous people. So we have a group for research on Indigenous people, and we've also been supporting a Canada Research Chair on Indigenous health as well, as something that our institute would like to support. So I think that this is something that's very much something we're very aware of, and we do really want to work on a number of different topic areas. And I think Aaliyah's first seminar in September on intersectionality really laid out a lot of the really excellent ideas that she has for that portfolio as well.
Thank you, Christine, for highlighting those concrete examples. The one comment I'll just make is that the Cummings School of Medicine and the VPR's office are actually quite receptive to the concept of an EDI chair. And sort of in feedback that we've now received after the original competition, they've highlighted some ways that we can potentially strengthen that submission to make it successful going forward and to increase the chances that it'll be successful in us getting a scientist into that role that can help us with this.
So I just wanted to flag that Nancy Marlette has made a couple of engagement suggestions. Of course, that's her expertise. So questions around engaging people on the seminar time period, and also engaging diverse communities. So I think you can comment, or else we can just move on, but I think that we have to obviously figure out mechanisms for engagement. I'd also just say that there will be some census taking around self-identity for race and ethnicity, which the Cummings School of Medicine and the university is doing, which is going to be very helpful as well for our work. There's a question here for, if we could switch, we can go back to this topic. I just have another one I don't want to lose here. We've got a question about the role of IPH. I'm trying to move this guy. Apologize. Chat is not as easy as Q&A here. What do you think the role of the IPH is in providing study design and data analysis support for our OIPH members? And how do you see the OIPH working with other University of Calgary research institutes?
Do you want to lead off on this one, Christine?
Sure. So one of the first groups that we did work with that's part of our institute is the Word of the 21st Century. And my understanding is that they actually have in the past provided quite a lot of assistance to investigators who are interested in putting in grants and having assistance with the grant proposals. Afterwards, once the grant is funded, helping with the data collection and data analysis. So that's actually a real jewel in the crown that we have within the institute. We, of course, have a very active internal peer review process. And as I said, we're going to be expanding that to allow us to help investigators at much earlier stages of a grant proposal development, and then going that all the way through from, smallish catalyst kind of grants that we do fund right through up to big team grants that we would like to help our institute members obtain. So there's certainly, the Institute is definitely here, I think, and very supportive of trying to help people arrange that kind of support for their projects. We do also have a methods hub within the Institute. And so these are people who have expertise in both qualitative and quantitative analyses. And so there definitely are experts within the Institute who are willing to share their expertise with others. And so we are definitely matchmakers in that respect, and we can help, support the Institute members and connect you with others who might be able to support your research.
Yeah, and I agree with Christine. I think as an institute, we really want to support our members in being successful in their science and in knowledge translation. Some of that support will come from the Institute. Some of that is going to come from trying to foster individuals coming together to work in teams. And how we make that, we'll have to sort through that as we do our strategic planning. But fundamentally, we really want to support individuals to be engaged and then to be successful in their grant submissions, the work they do, and then disseminating it.
Jamie, did I see your hand up?
Yeah, I just wanted to add to that answer that I think one of the most important things we do in the Institute is understand the entire environment of what's available as resources for the members. So in that last answer, we might point out that the Office of the Associate Dean Research in CSM has an amazing team now. So there's lots of things that we work together with and they help us on, and lots of things through the SPORE, ABSPORE Alberta's SPORE support unit as well. So knowing who we can go to bring in, we manage to make the most of the resources we share together. Thank you.
So artificial intelligence will have a major effect on society and the nature of work. Does the Institute have a plan to engage this issue?
It's a great question. And so Christine will know as well as I that, and Christine did a lot of work on this actually over the summer, which was, we have a CRC chair, tier 1 chair in data science. That's was previously had a couple of postings, had some excellent candidates identified, and unfortunately weren't able to attract these individuals to come here. So that posting's been has been put up again. Search, I'm co-chairing that search with Fiona Clement, the Department Head for Community Health Sciences. We're very fortunate that the previous searches were structured from a salary perspective to require it to be a clinician, and effectively really targeting salary lines within the Cummings School of Medicine, within the clinical departments. But for this current search, we've managed to get greater flexibility, and now we've got a salary line from the chair itself that allows us to recruit a PhD-trained scientist, which we're hoping is going to improve our chances of successfully getting a data scientist to come and join the Center for Health Informatics, which obviously is growing, and that artificial intelligence, and obviously the Center of Health Informatics, it's not just about artificial intelligence, but that will be certainly one of the elements for it, and we're hoping this data scientist will help to galvanize that. I did mention earlier Connect Care, and that's just one database, but it's a really exciting database because it's going to put all electronic health records in the province in a single location in a pretty granular way. And while that's immediately of benefit to health services researchers, one can see that if one wants to look at hospital-based care and outcomes, that it could have a big impact on population researchers as well. And so once again, that'll be an important tool for us as an institute to take advantage of for our community. Christine, do you want to add anything?
Yeah, so the only other Canada Research Chair that we worked on this summer was one on data visualization, and that was a joint effort between the Cummings School of Medicine and the Faculty of Science, and that has gone forward to the VPR level and has received some interest there. I think that there's going to be potentially have to be a little bit more work on conceptualizing that, but what that showed me was that there's a lot of collaboration that's happening between the Cummings School of Medicine and other faculties. And certainly that's a defining feature of this institute as well, is that we do have representation from nearly pretty much every faculty, I would say, in the University of Calgary, but also a large members from Alberta Health Services. And so any of these kind of data science initiatives, artificial intelligence, we can really draw on a whole lot of different people to work on that. So it is definitely an area that we're interested in.
So there's a lot of talk about recruiting great people, but there's also, you mentioned, Tom, that there's very difficult political and economic climate. So the question is, how are we going to recruit the best people for Canada Research Chairs and otherwise in this political and economic climate, including COVID-19?
Well, I'll jump in there. So that's a tough question. It's a good question. It's a tough question. I think it's important for us to recognize that that challenges really provide big opportunities for us. And I think we need to sell them that way. And so, I just finished as department head for critical care medicine here on Saturday. And I can tell you in that role, the uncertainty and turbulence in the health system certainly can be seen as a challenge. But at the same time, it's an incredible opportunity, which I was able to see firsthand, because it's during times like this that you can actually get things done that you would never be able to get done when things are more stable. You wouldn't be able to bring people together to take on some of these important challenges. So I actually think that while the environment, the COVID-19 situation on the, superficially might make us think that this is going to make it more difficult, there's actually tremendous opportunities. And I think this is where, as an institute, one of the major attractions of recruiting people here is to come work with you and to work on on the vision that we're going to collectively create to advance public health. It's not to say it's going to be easy, but I think we can do it. And I think that we've also been adapting tremendously over the last several months in the pandemic to use other technologies, both for care, but also in terms of how we conduct research. I mean, most of you are probably joining this call from your homes. Most of you all of you are working probably as hard, if not harder, than you were prior to the pandemic, and we're making a difference. So I'm convinced that we can use that to our recruiting advantage as well. Christine, do you have any thoughts about that?
I mean, I've always felt that if we have strong leadership and we have strong scientists and strong researchers and strong clinicians here, that those are the people that will attract others to come and work here. And so we certainly have, a lot of very positive attributes. I've been to a number of the strategic research committee meetings that Dr. Zamboni holds, and I've been very interested to see that the University of Calgary has become very successful as far as attracting grant funding from the Tri-Council agencies. We're now in either the first or second position with the total number of grants received in 2020 and the total funding received, which is quite a remarkable achievement, given that the University of Calgary is actually a much smaller university than some of the ones that we're competing against. And McGill is, I think, in the sort of vying for #1 position with us. So that tells me that the investment that the university has made in improving all of the processes that we have for doing research have really been paying off. And I think in the O'Brien Institute, we've actually put a lot of effort into internal peer review and trying to ensure the success of our members. When we have successful members, we have a higher profile at a national level and at an international level. And those are the kinds of things that people will notice, and that's why people will come and work here. So I think that we just need to keep doing that, despite whatever is happening in our political and economic environment. We have to try to just do the best that we can and make ourselves relevant and known at a national and international level. And I think that kind of success will, attract more people.
So we've talked about artificial intelligence and some of our methods and diversity, but what about qualitative specialists? So the question here is, how can we ensure that qualitative specialists can thrive in our environments across the campus, including Foothills campus, almost thrive as much as our Center for Health Informatics? Or maybe more.
Yeah, so I would echo Lynn's comment, right? I think that we want to use a diversity of methods to answer important public health questions, and in medicine we my field, we joke about the fact that an orthopedic surgeon who has a hammer, everything looks like a nail, right? But the reality is that in research, we need diverse methods to answer different questions appropriately. And so one of the things I think we want to think a little bit about is how can we create integrated teams that are probably not methods-based, but are focused on answering and addressing important questions and issues. And those teams are going to require individuals with different content expertise, different methodological expertise, which I think will be important. From a very practical perspective, you know, one of the things I think we need to think about is how do we help our scientists who have a qualitative expertise to target SSHRC grants. It's become clear that SSHRC would like, you know, a health perspective to be included in its applications. And I think that as a university, this is to date a relatively untapped opportunity for us, which would then allow us to sort of help our scientists get some resources to then support their work from a qualitative perspective, which will be essential to be integrating into teams that deal with bigger problems. We want both quantitative and qualitative perspectives there.
Yeah, I really want to echo what Tom's just said, because Penny Pexman did a very nice seminar for us early on about, in September as well, showing how SSHRC has now changed the types of grants that they're willing to receive to include ones focused on health, which used to just be in the domain of CIHR. And so the OIDR, the Office of the Associate Dean Research, is really helping us a lot in identifying those opportunities. SSHRC grants actually have much higher success rates than CIHR grants do. And so I think this is something that as an institute, we really want to support more people applying to SSHRC. And of course, they're, you know, doing qualitative research is actually something that's very much supported and understood by SSHRC. And I agree with what Tom has said, that I think we want to be developing multidisciplinary teams. I think that's the way the university is going with their growth through focus strategy. They're looking at multidisciplinary teams across campus, and that will include all kinds of researchers. So that's actually something we really, really want to support too.
So Joe Vipond, you've got your hand up. Would you like to ask your question?
It's actually just tying on to exactly what Dr. Favreau just said. So maybe, can I just read off Dr. Favreau's question and then my follow-up?
Yeah, sure.
Dr. Favreau said, we're living through the largest global pandemic in the public health crisis in 100 years. It's shone an unflattering spotlight on many of the structural and systematic equities that lead to disproportionate negative impact on segments of our society. There is a policy window here for public health if there ever was one. What is our collective plan to leverage evidence, science to inform real policy change as a result of COVID-19? It can't just be more grants and papers. And then my follow-up, I'll just read it because I wrote it in the chat, is what's the role of the Institute in doing advocacy to push for strong public health measures locally and provincially, just recognizing that we have a government that's explicitly stated that there's no role for mandates in governing the pandemic, which flies in the face of successful efforts elsewhere. And I think in a kind of a follow-up question, would the Institute be willing to convene a discussion group on the airborne aerosol transmission of COVID-19 and the policy implications of this?
Great questions, thank you. I think, you know, it's clear that the COVID-19 pandemic has completely shifted the scientific landscape in Canada and around the world. It's shifted it in terms of the focus of research people are doing. It's shifted in how people are doing the research. And it's exacerbated or highlighted and actually exacerbated some of the social and structural inequities that we have in society. And so there's some important questions raised there. I'd say that the first one is that how do scientists respond to this? And I think we've seen variable responses. And I don't know if there's a right answer here. And how does the Institute support scientists in their response? And by that I mean, you know, one approach is to take advantage of the existing opportunities related to COVID-19 to shift one's focus of research towards that. And I think that probably makes sense for some individuals. It doesn't make sense for others. And we have other really important public health challenges that we do not want to fall off the radar. And we want to support our members to continue working on those. Gabe's, I think, makes an important point that there's an intersection also between some of our existing public health priorities and the pandemic. And I think that actually provides potentially an interesting and really impactful way for the Institute to potentially contribute to the science and dialogue here, which is focusing on those areas of public health that we currently have expertise in, that are being impacted by the pandemic. And that could be, for example, social and structural vulnerabilities. It could be how it impacts different communities. It could be how it impacts how health delivery happens within the system. So I think that those are all important. I think fundamentally, we're a research institute. And so what we really want to be doing is creating science, answering questions, and then translating that. And what's really unfortunate that we've seen in the pandemic is that initially, I say there's some good things and bad things. So the thing that's maybe not so great is that we've seen a politicization of the pandemic. And that's happened actually in Canada. And we've seen it where we've got sort of extreme positions being taken on policy issues that really have actually either no or very moderate science to support them. And I think as an institute, what we really want to do is be championing for science to help inform that decision making. And masking would be a great example of that, where the evidence to support masking is pretty moderate, to be honest. And yet what we've got a political debate that's highly polarized around something that really needs additional data, to be honest. The second thing, though, that I think is really positive about the pandemic is that it's highlighted within our province and other jurisdictions that when you've got these big problems, and if you actually bring the public health system, the healthcare system, and academia together, as we've done in snippets, is we can have a big impact and make some good decisions. And I think that's what we really want to do, is continue to leverage that, not just for the pandemic, but for other public health challenges. I'll stop there. Christine, do you have comments?
Yeah, I think a very good example that we just had at the beginning of the pandemic was when Mayor Nenshi came to the University of Calgary and asked the university to help in their COVID-19 response. And so an advisory group was established, and we have been providing to this day some advice to the city of Calgary on how they should respond. And there's been, lots of opportunities to address very specific questions around social and structural vulnerabilities that the city has identified and that we are trying to advise them on. And Katrina Mullaney's been involved with that as well. I also think that with our health policy initiative, we are thinking about how the Institute can have a bigger impact and how we can help inform health policies at a provincial and national level. And so those are areas that are still somewhat nascent right now, but I definitely see that as something that the Institute will be working on into the future. And we're very open to your input on that.
Pete Fenwick, I know you wrote a very long note, but you're getting a lot of upvoting. So could you please make your point and comment, because I think it was of interest to everyone.
Sure, thanks. Thanks for the invitation, Lynn. So the short notes are, it's election time in the U.S. and there's a lot of debate. It doesn't really matter what political stripe you're at, but an undereducated masses, lack of critical thinkers, perhaps because of a failed public education system in the U.S., not wanting that to come into Canada. How can the Institute reach farther upstream from healthcare to social services, maybe right into public schools, to better impact the minds of a future generation, so that we actually have not just more STEM and STEAM talent being emerging from the public system, but for perhaps being a better role model to our neighbors.
Great. So there's quite a bit of chatting going on, and just to capture the real discussions around family medicine, primary care, innovation. So there's going to be some fantastic work done for sure when we get to strategic planning. Guess what I'd like to do is take the question on, well, maybe we could talk about the question of primary care, public health, family medicine, how O'Brien sees that moving forward.
Just before we get off topic,
okay.
Do you want to actually give Tom a little room to respond?
Oh, yeah, sorry.
Education.
Yeah, sorry, it was I thought it was a comment, but it's also a question, sure. Sorry.
Yeah, Pete. So, I mean, it's a pretty ambitious agenda you've outlined there, and a big question. I think that, you know, as an institute, what we need to focus on are really what are the biggest public health challenges, and where we have the expertise and the capacity to tackle them. And that's both conducting the research and through knowledge translation. So maybe answering your question, it may actually be more around knowledge translation, knowledge brokering. Is how do we foster dialogue, a civil dialogue as scientists, around asking questions, answering them, and then having a rational discussion around them. And so I think we can role model that. I think that we can engage in a public discourse around that. And I think that may partially address what you're getting at. You know, fundamentally, I think what we really want to do is help build communities that use knowledge to make the best decisions about tomorrow's biggest problems. And I think members do that individually and in teams. And as an institute, I think that we can help foster that. Christine mentioned earlier, you know, there's discussion within the institute about a policy center or a policy role, and you know, and that's sort of undefined at the moment. But one of the things we'll do with our strategic planning is figure out what role should we play in policy, what should be done within the institute, what should be done in partnership with the School of Public Health, and with other institutes that may start to address some of the questions you've asked there.
Just to follow up quickly, I think we have lots of research impact assessment folks on the call. You know, reaching forward, you know, logic model it backwards. Think not just 3-10 years hence, but maybe what's the 20-30 year window, and not ignoring that just because it's a long tail.
Great comment, Pete. I thought 10 years is a long tail, but that's maybe 10 years for a scientist, not from a societal perspective. You're absolutely right.
Okay, so I was trying to bundle some of the comments into questions. So there seems to be a bundling of comments around the relationships in the health system with primary care and family medicine, as well as public health. And then there's another bundling of the how upstream, of going upstream in the inequities domain. So I'd like to maybe both of you just to give comments around those bundles of partnership opportunities and areas of emphasis.
Christine, do you want to lead us off this time? No? Great.
No.
It's what you do with 75 chats that are all getting super excited.
You know, I think that there's a lot of opportunity there. One of the things that we're very fortunate in the province is that we've got a variety of community-based organizations, public health organizations, and AHS, in particular with the strategic clinical networks, and efforts to engage primary care in terms of planning that I think provides opportunities here, because obviously public health transcends all of this. You know, and as an institute, we have historically been very big tent in terms of trying to engage and capture individuals across this entire spectrum. And I think we want to continue doing that. And what I think we want to do is try and identify some key challenges where groups can come together to target important problems. And realistically, none of our health challenges can be siloed. We may want to some extent have some of these silos to concentrate expertise, but we want them to be porous so that they can collaborate and address these issues. Primary care, hospital-based care, public health, all of them.
I think that we've had actually quite a bit of success already in the Institute in these areas, and I think we should just build on some of those successes of working with our primary care partners and family physicians and, you know, immigrant health. I mean, I can think of a number of different areas, and so I would just welcome, you know, the Institute members to come forward as well with some ideas. That's the whole point of these kind of sessions that we're having today, is to have that dialogue with you, so we know what it is that you think is important and what you want us to focus on.
Well, thanks. I think this is when they say, you know, there's a time for one more question, and I mean, we've got, there was more questioning around the Indigenous Health Dialogue. There's been more questions around who we partner with. There's been questions around the outcomes that really matter for our work, and to whom. I think so. So I think I just ask you both, and in terms of the takeaway messages from the. It's important when you go into strategic planning to know the questions you're asking, because you've got to find the answers for those. So perhaps we can just ask you just to think about the kind of questions that came out of today that are probably the most important for going forward that we need to answer for the strategic plan. And I can start with Christine, then you can have the last word, Tom.
So I mean, I think we always have a bit of a struggle as an institute to think about whether we focus on some few topic areas or whether we try to be a broad umbrella to cover everything. And today we've heard quite a wide range of different topic areas. And so that's one of the things that we do need to hear from the members is, do we try? I see Gail O'Brien's on the Zoom, and I'll do a shout out to Gail, because Gail often says, the O'Brien Institute, it's kind of hard to get your arms around it, she says, right? Because it's big and it's broad, and it does public health work, and so it's better health care. So it's huge. So the question is, do we try to do everything, or do we try to focus on some topic areas? And so those are the kinds of things that we're actually at a crossroads right now as an institute, is thinking about exactly how we want to move forward and how best to do that, so that we do something that is impactful. Because we basically want to do impactful research. We want to make a difference with what we're doing at a societal level. And how can we do that best? And so those are the kinds of questions we're going to be putting to you as members, and looking for your input and guidance to help us maybe do some of that focused thinking, so that we can be proactive in the future and not reactive, and think and do some really good thinking and planning, so that we can actually improve, the healthcare status and the health of our populations, because that's really what we're trying to do.
No, thanks, Christine. I'll just sort of build on that and saying that, I think we want to hear from you is, how do we engage you most effectively, and how do we expand our engagement? We have a very large membership, and as highlighted here in the chat box, diverse, lots of different experience, lots of expertise. And this is where our value is. So how do we engage you, and how do we grow engagement? Because there's other communities that aren't aware of our institute that we want to pull in, that we would benefit from working with them. I think we need to basically both provide a big tent institute as well as some focus. I think realistically, we're going to have to do both. Obviously, the diversity of membership and expertise is, we want people to feel a home within the institute. We want to support them. And so what we need from you is some guidance as to how do we do that, when recognizing we're not going to have the resources to be able to spread resources across every single priority. So what are strategic ways, whether it's through IPR, whether it's through support of trainees, whether it's through mentorship, that we're able to support all of you collectively. And then at the same time, we need you to guide us as to where is our collective expertise and willingness to come together in teams, where there's going to be a critical mass of individuals that can come together in a team on important issues, where then we want to sort of make those maybe sort of signature specific projects beyond some of the work that we all do as individuals. And so I think our goal is, as Pete highlighted very nicely, our goal is to, yes, we want to impact, we want to get grants, we want to get papers, but most importantly, what we want to do is have a meaningful public health impact that's long lasting. And we can say 10 years, but really we want that impact measured over many years. And so we asked you how we can think about that as well.
So thank you, everyone. We had over 155 when I was watching the participants, and that's great engagement, and it's a great start to this new leadership, and hopefully we'll have a really good day for the rest of the day. Bye, everybody.